Hello, my name is Amanda Purnell, and I'm here to talk about democratizing data for veterans. For many of us, myself included, data is intimidating. We don't think in computer code. We think in stories and in pictures. So let me tell you a story today about a veteran. Let's call her Veronica. Veronica grew up in Texas, enlisted in the Army, served as a medic for 8 years, deployed a few times serving her country. She came back, got married, had some children. She's been working, taking care of her kids. At night, she's going to school to try and get her nursing degree. Veronica contracted COVID, and she's been continuing to experience COVID symptoms and trying to understand what's going on with her. So I imagine now that you have a real sense of who Veronica is. Let me tell you one more thing about Veronica. The image that you're seeing on this screen right here isn't a real person. This image that you're seeing is generated by computer code that learned from thousands of real images and was able to artificially create this synthetic image. Let me tell you why this is important. As part of our human-centered design approach to solving problems, we examined the current state of data to serve veterans. The first thing we learned is that we absolutely need to protect our veterans' healthcare data. Their stories, their images are protected, and we need to maintain their privacy. Second thing we learned is that that data, those stories, are locked behind people who think in computer code. How can we unlock data to serve veterans? We put on our human-centered design hat, and we wondered, how might we increase access to solve problems for both novice users, people who don't think in computer code, people who want to solve problems for veterans just like Veronica, as well as expert partners and collaborators at academic medical centers, nonprofits, and other government institutions who also want to serve veterans, but we want to be so careful with their protected health information. So how might we solve problems for veterans using data, protecting their privacy while increasing access? And what we have done, Kit mentioned that every innovation takes thousands of people, and this is similar. Hundreds of people have been involved in building Arches. Arches is a platform of platforms, and we have built it to connect users who want to serve veterans, protecting their privacy by creating synthetic stories. So just like that synthetic or artificial image that you saw of Veronica earlier, we can create synthetic healthcare stories and work with partners to unlock insights to help understand veterans like Veronica who may be experiencing continued symptoms of COVID, who may have diabetes or other healthcare conditions, so that we can engage those expert users in testing and validating personalized healthcare systems using data to serve veterans. And for those expert partners, state-of-the-art technology and solution designed just for their use cases. We're excited to announce at this event that Arches is not a future state. It is here. And we want to invite you to join us and to partner with us in solving problems for veterans, with veterans, to make sure that all of our voices can be part of the journey to support and serve veterans with compelling information, to provide the right information to the right person at the right time, personalizing care for our veterans and solving problems together. I encourage you to send us a message at vhaarches@va.gov, and thank you for your interest in solving problems to serve veterans.